same, how will you ensure that patients get the right medical professional contact at first, or maybe professional at first contact? Because then, for example, how will you ensure that an expectant mother then goes ahead to meet an obstetrician, do they call them that way, at the first contact, so that, you ensure that they get the highest standards of care, because there's a lot of mismanagement that is happening.
Health professionals have their levels of operation.
Right.
You don't expect to find a CHP in level 2.
Without doubt.
Okay?
Yeah.
Because their work is at level 1.
And they know it.
And they know it. You will not expect to find maybe let's say who?
A dentist in a different...
Not even a dentist. You don't expect to find...
A clinical officer.
No. Clinical officers are at all levels.
All day.
But you don't expect to find operations being done at the lowest level of facilities in level 2. Okay? Level 2, you'll find either a nurse or a clinical officer. Because even the equipment in level 2 are basic. All right? So that is how referral system works. At level 4, that is when you probably will be admitted. Okay. Because maybe of complications, because it is a secondary facility. And we can go to even further, to check further diagnostics for somebody, depending on the kind of ailment you have been prescribed. Therefore,
no cause for alarm.
There's no cause for alarm at all.
Okay.
At level 1, you will find the CHP in the villages. And they are simply just checking. Are you okay? They'll find out if your children are okay, if they are malnourished, if they need some vitamin, and they'll be able to dispense of the same.
All right.
And then if you go to the facility, then you expect a more skilled person, like a nurse, who can take your vitals again and refer you to a doctor, possibly. Yes.
Okay, fair enough. That was on the digital. We want to talk about finance?
Yes. Digital Health Act of 2023.
Okay.
Then we have the Primary Healthcare Act of 2023 that takes care of the mashinani facilities, or the level 2 facilities and level 3. Yeah. Again, they also touch on the CHP. Remember, the CHP right now, their role is entrenched in law. So we are able to know what exactly does a CHP do. What exactly will you find at level 2 or level 3? So at the Primary Healthcare Act. Yeah. We also have something called the PCNs, Primary Care Networks. A primary care network is geographical mapping of facilities within the same locality or the same geographical area. That is why when you get into SHA, there's a list of facilities that comes on your screen.
Okay, you're advised you can use these.
I don't know if you have registered.
I have.
Okay.
To be honest, I
then
have.
you must have come across the facilities that are in your area, and you're told you can choose your primary facility. So that is the primary care networks. And already we want to have 315 PCNs across the country. Number 3 is the Social Health Insurance Financing Act of 2023. And the Social Health Financing Act of 2023 is the one that holds SHA. The SHA is the authority. It's actually the house that houses 3 funds. And one of the funds is the Primary Care Fund. The Primary Care Fund takes care of the primary care facilities. The level 2, level 3. That is why you're not supposed to pay if you go to those facilities, because it's exchequer funded. Then we have the Social Health Insurance Fund, which is a harambe between me and you and members of the public.
Right.
We pool resources together. Then finally, we have the emergency, chronic and critical illness. Initially, you'll find you have accidents, you're taken to a facility. Before you give a deposit, you cannot be admitted. That's a thing of the past, because everybody has to be treated equally whether you have an accident or you have gone because of flu or any other. We are looking forward to having availability, accessibility, affordability, and acceptability of quality